This is the 5th exhibition of the Uganda farmer. Really, we say we've made good strides. You know, the beginning sometimes is not always easy, but since it started and now we're on the 5th one, we can really congratulate ourselves, all the stakeholders who are involved in this, starting from the ministry, the media, the chairpersons, exhibitors, Uganda Manufacturers Association, and so on. It has really been great strides. What I want to highlight is that when it comes to the pharmaceutical industry, there are always trending, there are always changes, or what we call improvements, innovations, and changes in the guidelines, in the treatment, in the diagnosis. So that is why such an exhibition is very important, because we are trying to showcase, to educate about everything that we call a new innovation. So exhibition for the pharmaceutical industry is really timely, so that we educate, first of all, the public, the business people, the professionals about what is new, where to access it, and so on. What I want to highlight, that has already been said by Dr. Singh, is that it's not only about medicines. If you look at our flyer, you will see that we have medicines, we have surgical equipment, we have herbals, we have laboratory, orthopedics, dental. My colleague from the dental has elaborated so much, hospital beds, and so on. So when we talk of a pharmaceutical, we are trying to mean something that is used for diagnosis, for prevention, for treatment, and so on. So it is really a cut-acrossing exhibition as far as the medicine and pharmaceutical industry is concerned. So we encourage everyone to really be there. When we look at our theme, it is clear here: strengthening access, quality, and sustainability in healthcare for all. As Ministry of Health, we are really in agreement with this, and we've tried to strengthen access. Quality is always assured through the National Drug Authority, and sustainability. With access, we have gone, of course, predominantly we've been providing care through our health care or health facilities, but we have decided with the theme of improving access to go even past the health facilities and take services to the community. The spokesperson has already talked about self-care and community services. That is where things like self-injection, self-testing come in, and we have very many services which can be accessed nearly with this same spirit of strengthening access. So that's why I said the theme really aligns with what we believe in and what we are doing as Ministry of Health to increase access. We've also strengthened our public-private partnerships. We work with the private pharmacies, sometimes provide care. We work with private hospitals, both purely private and private for not-for-profit. So we are committed to strengthening our access or our service delivery as Ministry of Health. Well, regarding to pharmacies, we have some partnerships where we have provided anti-malarials, test kits for malaria, but also sometimes antiretroviral medicines, or what we call ARVs in common language, whereby some pharmacies are actually providing this. And just beyond that, really, public-private partnerships is stronger than that. I will not be able to give the details, but yes, it is becoming stronger every other day. It has already been highlighted. Since we started, we had few industries, very few, but right now we have industries manufacturing almost all categories of pharmaceuticals. We can manufacture tablets, we can manufacture parenterals, those are IVs, what in layman's language we call injections. We have been manufacturing herbal medicines and so on. So you can see that we are growing really.